Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. Before I talk to Rachel here, and her story is going to be amazing and inspirational, especially for any of you who have severe brain fog or wonder if you're ever going to get better. I just wanted to tell a story like this morning. As I said to you, Danielle, my associate's here, and then she treats you along with me treating you well. We had another mutual patient. And so Danielle met me out of the room after I had seen the patient and she had seen the patient. And I'll just call the patient's name Sarah. It's not Sarah, but she said, Sarah's absolutely why we do what we do. Like, she had had a problem almost since birth, and now she's around 20. She's not exactly 20, but she's around 20. And she's basically getting completely back to normal. Like, your story also is significant in that, there probably was times that you thought, like, am I ever going to get better? Because no matter if you've had something a day, 2 days, 10 years, 20 years, if you correct what's causing it, it's going to get better. So, because you've had, tell us what the main thing that we've helped you with, and then how long have you had that?
I had severe brain fog and memory issues, lots of neck instability, and I was actually in a wheelchair for a few years. And
like, you actually came here on a wheelchair?
Yes, yes.
You were in a wheelchair. Like, you would have no idea now because you go shopping and walk around like totally normal.
Yes.
Yeah.
And I'd been going downhill for 15 years now. My condition I've had since birth, but my health started going downhill about 15 years ago. And since I've been coming here, I'm out of the wheelchair. I am working again for the first time in 12 years and able to focus and be present in my own life. And my husband says he feels like he's got his wife back. Like, I'm a completely different person. I'm not walking around like a zombie, and I'm not so medicated out of my brain that, I have to be on painkillers all the time.
What are the various diagnoses that you got for your brain condition? Like, did you get like they said you were depressed, or what were all the diagnoses that you had prior to coming here?
Well, I've got EDS and POTS, and they told me I had depression and anxiety, and that I've got white matter disease, which will create memory issues. However, my memory has been improving, especially my short-term memory, and I haven't really had an issue with it in the last few months, so this is great.
Was there ever a time where you got hopeless? Like you said, I can't live like this. I mean, obviously you're a mother and you got a wonderful, daughter, and you have a wonderful husband, but there must have been times where you're like, I just can't live like this.
Yes, there absolutely have been times that I wished that it would just end.
Okay.
There have been times that I've laid in bed for weeks and wished that I thought it would be better for everybody if I wasn't a burden and if I wasn't here anymore. Thank God I am not laying in that bed anymore, and I am not in that chair anymore, and I am not a burden anymore.
So why don't you explain, from your understanding, what was the condition that we found that you had, by the testing we did, and then what treatment did you have, and then, how you're doing. So if you were explaining it to somebody, what was the condition that you had that's getting resolved and is almost 100% resolved?
Well, we started out treating my lower back and my knee for instability, severe instability. My knee was dislocating all the time. And then
So then you couldn't really walk.
Right.
Okay.
Right. There was no stability, and it just was, I was in pain all the time. And we started treating that, and then we also started treating my neck for severe instability. And after 2 treatments with my knee and my lower back, I was up and walking more and moving more and able to stand for longer periods of time. And then we started treating my neck, and my dizziness and my brain fog started getting better. And that was immediate with the neck. It took the knee and the back about 2 treatments, but...
How many treatments have you had total?
4, maybe 5, I think.
Okay. And we're hopeful maybe today's your last visit.
Yes.
Then what have your friends said, or what have your...
They think it's miraculous and amazing.
Okay.
Absolutely miraculous. Everybody is just so thrilled and amazed.
Tell us about your job. Like, what Like, you haven't worked, like you
No,
said, for 12 years.
I
So,
haven't worked for 12
tell
years.
us about your job.
I quit working after my daughter was born because I just couldn't stand that long anymore. And I never used my degree in business. And my friends own a business, and they brought me in to help do office work and organization. And it's just been a godsend, using my brain and feeling useful and feeling helpful again.
What's your daughter say?
She is tickled and thrilled because I can go out and walk with her and be in the pool with her and go on hikes again, and just, she is so glad that I'm able to be more with her and remember things and take her places.
And how would you describe prolotherapy to somebody? Like, it's not that easy of a treatment to do.
No, it's not that easy of a treatment to do, but it's not that hard either. The injections are painful, but it's over quickly, and you may be stiff and sore afterwards, but it doesn't hurt for several days afterwards. You're just kind of stiff and hard to move around a little bit, and then it just gets better and better and better. I've actually gone through this and had just anti-anxiety meds and Tylenol, and last time I took half the dose, and this time I'm not taking any.
Okay. Were you on medicines when you came in, like when I first saw you?
Yes.
Why don't you describe some of the medicines you're on, and are you still on them?
I have been on Neurontin, gabapentin, for several years now, and they had me on a massive dose. It was 800 milligrams 3 times a day. And I have backed off of that, and we're about to step down again, down to 800 milligrams once a day, and hopefully off of it completely.
Okay.
And my POTS meds we're about to step off of completely.
Yeah, so for people who know, like when people come in, people have other physicians, like,
Yes.
They have other physicians. And normally the physician who prescribes the med should really be the one to get them off of it.
Yeah.
And there's another reason why I don't do it is part of it is part of the education of the doctor who prescribed it. Like, you understand, there's very few people that they probably have in their whole practice that the people can actually get off of the med.
That's
not
true.
because of a side effect, but because the person doesn't need the med anymore.
Right.
So I'm sure they're probably like looking at you like, what's going on with this lady?
I've actually got a follow-up here in the next week or two, and they are thrilled. They know that I'm coming here, and they have been absolutely, completely on board with this.
Good,
and are
awesome.
completely thrilled and so happy that I'm coming down from these meds.
I've heard more and more, and I don't know if it's the internet, but I've heard more and more. Even this week, even today, I got an email of just how the doctors are starting to put together that problems in the neck cause a lot of things. They cause like vestibular dysfunction. That was an email I just got from a prospective patient that the doctor is supportive because they think the dizziness and the vestibular functions from the neck. And then and that person also has vision issues, and the doctor suspects even their vision issues because anybody who's watched me or these videos, I talk a lot about blurry vision and different things.
That's actually gotten better. I'm using my reading glasses less and less.
Okay.
So this is really good.
Because even today I had another patient who, they were just on their second visit, but they asked me, because they had just gotten like their prescription filled or something for their glasses, can it change when you get Prolo? Absolutely. So,
yes.
and almost all the time what happens is they need less of a prescription, they don't need as much correction.
Right.
So you found that too. Is there any other symptoms that you came in, like how's the POTS and some of the other symptoms?
My POTS has gotten almost 100% better. I still have occasional periods if I bend down in the wrong way and get up too fast that I'll get dizzy, but other than that I have not had any dizziness walking. I haven't passed out once since I've been coming here. This is awesome. It's been really amazing.
Any ringing in the ears or dizziness or digestive issues?
The ringing in the ears has gotten a lot better.
Okay, awesome.
And the dizziness has gotten so much better.
Yeah. Fantastic. Did you have any digestive things?
I did, and I still do. I've still got
Okay.
quite a bit of digestive issues, but
Okay.
we're dealing with that. So
Okay. Do you have somebody who's helping you with that?
I do.
So you think there's an additional thing beside a vagus nerve thing causing your digestive
Yes,
thing? So you're
they're
dealing
they're
with that. Yeah.
they're dealing with that.
Food
there.
sensitivities
Yes.
or something. Yeah, yeah. Okay. No, just appreciate you sharing your story, and hopefully today will be our last visit, so we'll miss seeing you.
It has been my pleasure and my honor to just come and be here and experience this. It's been wonderful.
Thanks, Rach. Appreciate that.